Thank you for joining us for today's panel discussion with AMD First Line Mentors, Dr. Teresa Scott, Dr. Robert McCoy, Dr. Kristen Lewis, and Dr. Leslie Holler. Doctors, if you'd like to go ahead and introduce yourselves, and then we can get started. Thank you.
Dr. Bob McCoy. I've been practicing general dentistry 45 years. I've been doing sleep and airway dentistry for the last 13. I've been doing the working with Dr. Liao with his initial class. I think this is back in 2017. So in essence, that's my background.
I'm Dr. Kristen Lewis. I've been practicing dentistry for 28 years and started my journey with AMD with Dr. Felix Liao back in 2017.
My name is Dr. Teresa Scott, and I've been practicing I'm a general practitioner. I'm a biological dentist, but I've been practicing airway-centered dentistry for the last 6 years. So since 2017.
I'm Dr. Leslie Holler. I'm an airway dentist in Miami, Florida, trained by Dr. Felix Liao.
Thank you, doctors. So the first question and point is, how many cases, doctors, have you started to date, and when was the first one?
Well, I'll go first again. Since my background starts with a common treatment modality with the DNA appliance, I will start there and say that I have done 18 of the DNA mRNA appliances, and I've done 23 of Dr. Liao's appliances. And the first one was really back around 2017. I think that there's some that were probably 15 that were DNAs, but the Liao's appliance was in 17 for sure.
Over the last few years, I've done about 60 cases, and the results vary from good, improvements in breathing and a little bit of improvement in sleep, to absolutely life-changing. People who have been living in chronic pain, neck and face pain, headaches, sinus problems, TMJ. It's amazing how knowing what to look for and how to treat the dental components of these things can make a huge difference in people's lives.
I think including children, we average about 4 to 5 cases a month where we're, starting a new appliance. If it's adults only, it's probably about 2 a month, but sometimes 1 a month. But I think total cases that I've started, I think were upwards of 250 at this point in the last 6 years.
And when was the first one again, Dr. Scott?
Oh, I'm sorry, 2017. I learned from him end of 2016 and started my first case. DNA is where I started because he trained me while he was still with Vivos. And I started my first case in, I think, March of 2017. So it's literally been 6 years, almost exactly. I grew very quickly. I had started, I think, within my first 6 months, I think I'd started like 60 cases. I was going gangbusters. I've slowed down a bit, mostly because I've learned more, and I go, I'm more selective about my cases nowadays. And what I choose to take on and not take on. But yeah, no, we still do a fair number.
Thank you very much. And Dr. Kristen?
Yes, I started, my first case was in October of 2017. And it again was DNA because that's what Dr. Liao was training us in at that point. As soon as Dr. Liao came out with the STA appliance, I immediately switched most of my patients over, and I've done approximately 150 cases, adults and children since then.
I'd like to add, I switched, I think about June of 2020 2021 to the STA completely.
The next question I'm gonna ask you folks is, how many natural teeth have gone dead or needed a root canal treatment or were lost to extraction in your STA cases?
Well, if patients aren't compliant, then it doesn't work very well, but we've never lost any teeth. And when patients do comply, it's all out. I have to say I'm very satisfied with having trained with Dr. Liao and having switched my profession to become an airway and tongue-tie dentist.
Yeah, not only that, but what I've, like the thing that's been in the news lately, et cetera, was like, that it was driving teeth out of the bone and so on and so forth. I got to tell you, none of the removable appliances that I've used have driven any teeth out of the bone. I've not had a patient kill a tooth while they were in an STA, not one.
Moving on to the next question, what are the leading improvements in your patient's baseline symptoms after starting the Start Thriving appliance?
Most of them, in my case, so I do a lot of kids, and I do a lot of airway in children. So the kids stop wetting the bed, stuff like that. But like the adults, what they notice is they start sleeping better. They start having more exercise tolerance. In other words, they don't get fatigued as quickly when they're exercising. And my singers have a deeper, richer voice, which not a deeper voice, but like a richer voice. That's the comment I've gotten from those who are singers. They can make the notes last longer, and they have richer tones in their voice. That's what they've noticed. But they also notice things like their thyroid starts to normalize, and their hormones start to become more balanced, and their blood sugars get better. So that's typically what I'm hearing after wearing their airway appliances. And a lot of them, their TMJ gets better, their headaches get better, so it does indeed help.
One of the first things I'll always hear is the pain goes away. They're, like Teresa said, the headaches and TMJ issues. And then later down the road, they start saying they're dreaming better and they're sleeping better. Kids will come in and say that and these are young kids that are saying, I can concentrate, I can do my homework. And then the parents say that it's easier to do their homework because their kids aren't bouncing off the wall. But yeah, I'd say the first thing I hear about is the pain is gone.
I would agree too. Once you move the mandible into the different posture, into that parking spot where it's what we call the pinky negative, it really unloads the jaw joint, and the many of the TMJ and bite related problems are they're gone because the trauma is not there, and that allows a lot of the cervical and neck muscles to go away. With the adults, the biggest thing that I hear without a doubt is, boy, I can breathe better. This is after 2 weeks. I can really breathe better and I sleep better with this appliance. So that, along with the other things related to the bite and the TMJ, they, without doubt, we hear it every time. And there are other issues going on that can be complicating, nasal problems and things of that nature, tongue ties. All of this we are diagnosing at the same time, but without a doubt, the breathing better and sleeping better are comments that come out of patients, whether they are 12 years old or whether they're 75 years old. It's the same thing.
We've spoken about, some of the leading improvements in your patients. What are some of the downsides of the STA from your patient's perspective?
In my situation, I would say the bulkiness of the appliance. Most of the time, I have probably never done an appliance with or a treatment with just an upper appliance. I use upper and lower appliances. The lower appliance usually is not the component that is bulky. I try to thin them out as much as I can, but there's a limit as to how much you can thin them out. And then there's always the issue of whether someone can speak while they're wearing the appliance. And there are many times when people are speaking and I don't believe it, but they have their appliance in their mouth. So this is a very individual thing as to where we go with that complaint. I've had some patients that didn't even want to start treatment because it was an appliance and they could see that it's too bulky for them. And I started down the road of using Invisalign, and and I can speak about that later, but I use the same principles as Felix taught us with all the diagnostics and everything. And then I just start to do the expansions and the people are thrilled with the results of with the Invisalign. But it's a different modality. It gives you there's different things that happen that do not, there's other things that happen with the appliance that do not happen with the Invisalign. And but it certainly takes care of the bulkiness issue. And so I'll just say that's a good time to point that out.
In my case, I'm going to say that honestly, because a lot of my patients were Vivos patients prior to me doing the STA, the feedback that I get is that the STA is far more comfortable and less bulky than the Vivos ever was. So, when I've switched them, the positive feedback is I get, yay, and they're happier with it. In terms of that, there's always going to be people who have just a super narrow palate, who give you the feedback of it's too narrow, but those are the people who are going to give you feedback when you put anything in their palate. They literally, they're that narrow, as far as that goes. And from my perspective, the biggest negative is compliance. Anything removable is going to have compliance as an issue. Mm-hmm. And we have, as long as a patient wears their appliance, we're going to get results, but obviously we're going to get not as good results if they're not compliant, or not really even good results if they're not compliant. And then of course the postmenopausal ladies are the slowest growers. So, sometimes I can only get them to turn the key once a month, because that's all their bodies will allow. And so we go at their speed. Even if that means we go very slow, then so be it. We go very slow. They're fine with that. And they still sleep better in that construction bite, with the appliance. So that's what we do.
And I'd agree with both of those. I'd say patient's biggest complaint is the compliance factor, wear time. I am with Teresa since switching to the STA. I don't have as many complaints about the bulkiness of it, but it's very minimal complaints that I have with the STA.
Yeah, I would agree there too. I said before that the size of it was number one, but I think compliance, I didn't even think about that. And without a doubt, the compliance is the biggest issue. But you can, even with minimal compliance, you can get good results. It just takes a little bit longer. Yes. This month, I was treating this guy for, I think, 18 months, and with an STA. He would only wear it at nighttime. And I don't know how many visits that I saw where I turned it back, where he had over adjusted it. I turned it back and got him, I seen once a month. And it got to the point, it's like, I don't think we can do any more for you. He says, I think you've already done it. And I said, what do you mean? He says, well, I'm sleeping better and I definitely breathe better. He says, I think we've got a success here. Oh, his teeth were all straightened out and everything looked right. He went and got a sleep study and he went from an AHI of 20 down to 6. And
Wow.
to my surprise, and that was just from wearing the appliance 8 hours a day and just at nighttime. But he was dedicated to that much time. And we look for 10 to 12 to 16, and but even to know that if somebody is a real dedicated to just nighttime use, they can get improvements. It just takes a little bit longer. But that was a real surprise to me. And but without a doubt, the compliance is wearing the appliance is the number one factor.
The one thing that I will add is that most people tend to assume that wearing the appliance will mean that they don't have to have orthodontics or whatever. And so I try to make sure that I inform patients that the vast majority will need some form of orthodontic treatment after expansion, that the expansion is purely that. It is expansion. It is not going to derotate teeth. It's not going to 100% fix the bite. It's not going to do that. It will expand the airway. That is our goal, is to expand the palate so that we have more room for the tongue inside the mouth and not in the back of the throat, blocking the airway.
Thank you very much, Dr. Scott, Dr. McCoy, Dr. Lewis, and Dr. Holler for being with us today.